Now, it was a catalogue of failings and mistakes that almost led to a vulnerable man being wrongly thrown behind bars.
A report obtained exclusively by PointsWest condemns a psychiatrist and 3 social workers for an appalling failure of duty. Police in riot gear went to the man's home after being persuaded by caseworkers that he was dangerous.
This is who they were supposed to be helping, 64-year-old Selburn Watson from Bristol. He had a history of mental health problems, but the report by Bristol City Council's Health and Social Services Department says that over several months in 2001 he was unfairly treated and his human rights disregarded in an attempt to get him locked up in a secure hospital. The report upheld 9 of his 16 complaints. It concluded 3 social workers involved were guilty of malpractice. Their limp and supine behaviour was unacceptable. One is accused of misleading a magistrate and giving false information. And a consultant psychiatrist is accused of being thoroughly reprehensible in the way he handled the case. Here's our Home Affairs correspondent, Steve Brady.
Selburn Watson watches as his belongings are removed from his St Paul's home. A direct result, he says, of the actions of social workers and the consultant psychiatrist condemned by the City Council report. He's now living in this single room at a refugee hostel.
This is the first time any acknowledgement has been made of the distress and the appalling situation that I find myself in.
The damning findings of the report were welcomed by staff of St Paul's Youth and Family Project.
I'm extremely angry that it's taken this long for this misjustice to be recognised by the council, but I'm glad that it finally has. And I hope that the further misjustice that's since been carried out against him with the eviction and placing him in a homeless situation is now going to be addressed.
The report is highly critical of the actions of a social worker who it says gave false information to Bristol magistrates, which led to a police raid on Selburn Watson's home in November 2001. And of a consultant psychiatrist whose participation is described as being thoroughly reprehensible.
He's my brother, and I'm here all along with him, and I see the injustice. And sometimes I do say something, sometimes I stand back and watch to see justice would prevail, but it never seems to.
Despite his suffering, Selburn Watson still has faith in British justice.
My character has been assassinated. So now I'm just a lump of flesh. That's how I feel about it.
All 3 social workers involved in this case now face an internal disciplinary inquiry. The council will also meet with Selburn Watson to discuss rehousing him. In any event, in view of the conclusions of the report, the council faces a substantial claim for damages. Steve Brody, BBC PointsWest, Bristol.
Well, Bill Mckitterick is Director of Bristol's Health and Social Services. Good evening to you. How could social services behave in this manner?
There's no evidence that I've seen yet that the social workers acted in bad faith, or indeed the psychiatrist did. But we didn't get it right. There were serious mistakes made, and information given to the court, I think in good faith, was not accurate. We were acting on information that wasn't complete, and we should have been more thorough before we took those serious steps.
But the report clearly accuses the social workers of malpractice, and you can hardly condone giving false information and actually misleading a magistrate, can you?
I certainly wouldn't condone that, and there were clearly very serious mistakes made. We were very keen to meet this gentleman and his lawyers to discuss what steps to take further, both to provide care and support to him in the future and to look at any issues of compensation that we ought to address with him.
So you're saying this was just a mistake, they were acting in good faith?
It's not just a mistake. A mistake is never acceptable, and we do need to take serious steps to make sure those are put right and that we take any action we need to within the organisation.
What will happen to the social workers responsible?
Well, this was an investigation about complaints about the service we provided, which clearly wasn't good enough. But we do need to look very carefully within our own disciplinary procedures, within a different sort of investigation, to see what action we ought to take in respect of the staff.
And what does it say about the quality and training of social workers if this can happen in this case?
I think part of the issue is the very difficult situation that they face every day of the week, and in particular situations where people are known to have very serious problems. We mustn't make assumptions from past behaviour or past incidents in how we address each new referral or how we work with people.
Everyone accepts that it's extremely difficult in many cases, but we rely on you and social workers to get it right, don't we?
Yes, and this is why we took the investigation so seriously, and why the conclusion of the investigation was so blunt in what its conclusions were.
Mr. Mckitterick, we must leave it there. Thank you very much.
Thank you.